Good morning and welcome to the weekly press briefing on the COVID-19 response for the state of Utah. My name is Joe Doherty. I'm with the Utah Department of Public Safety. Welcome to our media friends, and thank you to everyone who's interpreting in Spanish and in American Sign Language today. Today is Thursday, February 25th, and our two speakers will be Governor Spencer Cox, and he will be followed by Dr. Angela Dunn, our state epidemiologist. Governor Cox.
Thanks, Joe. Ladies and gentlemen, it's great to be with you again. We made it another week. We are 1 week away from the end of the legislative session, which is great news for everyone. I'd like to excuse Lieutenant Governor Henderson as she is engaged with legislators working on some important pieces of legislation. So we'll excuse her for today, but I'm excited to have Dr. Dunn with us today as always. So a week ago, I was happy to announce that because of increasing vaccine doses to the state and some slowing of vaccine uptake, that we would open vaccine eligibility to those 65 years of age and up. In just 1 week, we have given a first dose of vaccine to 29% of Utahns between the age of 65 and 69, which is just incredible news. Own expectations. The most common question we've gotten since then is, what about comorbidities? You'll remember that we had originally planned to start allowing people with certain health conditions, not all underlying health conditions, but the most serious underlying health conditions, about 240-ish thousand Utahns in that category, to get vaccinated in March. But we have committed to speeding up eligibility when possible. And so today, I am very pleased to announce that effective immediately, Utahns who are, pay special attention to this, Utahns who are ages 16 and up with certain comorbidities are eligible to be vaccinated. Again, please, before you schedule your vaccine, go to coronavirus.utah.gov/vaccine to look at that list of comorbidities and make sure you qualify. Now, here is where, if you are ages 16 to 18 and you have one of those underlying health conditions, please pay special attention to this piece right now. The CDC has only approved the Pfizer vaccine for people ages 16 to 18, okay? So if you are ages 16 or 17 and you have one of those underlying health conditions at coronavirus.utah.gov/vaccine, you can make an appointment for a location with the Pfizer vaccine to get your shot. Now, not every location has the Pfizer vaccine available, so we will have a list of locations with the Pfizer vaccine on that website. I know it's a little bit confusing, and it's just a very small amount of Utahns ages 16 or 17 that have those comorbidities, but please make sure that you schedule yours for a location with the Pfizer vaccine. Now, I also need to say that most pharmacies may not have these new eligibility requirements updated in their appointment systems yet, so please be patient. They are working to get that done. And also, we are using the honor system. I've said this before, but it's really important. We are going for speed over accuracy. That's a choice we had to make, which means that it is possible for people to lie about whether or not they have one of these underlying health conditions. We're not going to require a doctor's note to do this. But I'm pleading with you, please, please, please do not jump ahead in line. We have so many more vaccines coming, and they're coming soon. But we're prioritizing these individuals, again, based on age and these underlying comorbidities, because they are at the greatest risk of hospitalization or death. So if you jump ahead in line, that means there is someone else who won't get the vaccine as soon as they could have, and it's very possible that they could end up hospitalized or even worse, dying. So you can look yourself in the mirror, you can sleep well at night by knowing that you didn't cheat the system, that you were willing to give it to those who needed it the most. And again, we have some more on this, but those vaccines are coming, and we're all going to get one sooner rather than later. So I also want to update a little bit on some of our vaccine locations. Starting today, This is another really big announcement. So media partners, get ready, because this is one you're going to want to share, all right? We've had one big one now, comorbidities. Here's the second one that you're definitely going to want to share. As of today, as of right now, people who are eligible to get the vaccine, so those who are 65 and older, those with underlying comorbidities, and the earlier groups that we have announced, are no longer required to wait for appointments in their home county. If you are eligible and you can find an appointment in another county, that's perfectly fine. Go for it. We are no longer requiring that you stay in your own county to get that vaccine. Now, keep something in mind. All currently approved vaccines, so Pfizer and Moderna, require 2 doses. So if you do get an appointment for your first dose of vaccine in another county, you have to go back to that county for your second dose. Second doses are allocated based on the location where first doses are received. So it is absolutely critical that you always go back, not just to the same county, but to the same location to get your second dose as where you received your first dose. The other thing I really need to emphasize here is that vaccines, as vaccines are eligible to people outside of their counties, we need you to know that an appointment to get a vaccine is a dose. Okay? An appointment to get a vaccine is a dose. So if you cannot make it to your appointment, or if you find another appointment that's earlier than the one you have and you decide you want to sign up for that one, first of all, don't do that. Just wait a couple extra days and go to your original appointment. That makes it easier. But if for some reason you must do that, you are missing a dose, and that is a dose that could potentially go to waste. That is unacceptable. So you just must cancel your appointment. Make sure that someone else, by canceling that appointment, that someone else can fill that appointment and get it used. But please, once you schedule an appointment, please keep that appointment. What we don't want is a whole bunch of people not showing up, then there's nobody to take that dose. So at the end of the day, they're scrambling to try to get a shot in an arm. And we know that Utahns are better than that. So please, please, please keep your appointments. We also have some other partners that are coming on, and I want to mention one of those. We have contracted with Nomi Health to provide vaccinations throughout Utah. They've been doing this some over the past couple of weeks, and they'll be ramping up even more today. Some of those vaccination events that you may see for Nomi Health include vaccinations in your local community, as well as vaccinations at LHM Megaplex movie theaters that have been closed down during this pandemic. We're grateful to the Larry H. Miller Group for allowing NOMI to use those sites in communities to get more people vaccinated. And they're making it very quick and easy in these locations. NOMI currently has more than 5,000 appointment slots available to those who are eligible, including those new eligibility populations that we announced today. You can get those, again, on the coronavirus.utah.gov/vaccine website. We have a list of all the different providers, and you can click on those links and see if appointments are available. But I wanted to mention this one specifically, getmyshot.utah.gov. That's getmyshot.utah.gov for those 5,000 NOMI appointments that are available today. So that's another link that you can click in addition to your county links, and then some of the Smiths and Walmarts and other vaccine providers that are coming online. Now again, it would be much easier if we could consolidate all of these into one scheduling site and one sign-up site, but because the federal government has decided to distribute to some of these distinct from us, because everyone has their own process of doing this, we've decided again to embrace the chaos and embrace speed over trying to link all of these together, which would have slowed things down. So you may have to click on multiple links to find one, but keep trying, keep working through that, and again, we're going to keep getting doses in arms. Now, just an update. As of today, 660,000 doses have been administered. A week ago today, our total doses administered was about 563,000. Again, these are first and second doses. So weekly increase of 96,000 doses. You'll notice that's just a tick below where we were last week, and there's a couple reasons for that. The main reason was that because of the big storms that hit in the Midwest and the South last week, we had about 36,000 Moderna doses that did not show up as planned. And so this speaks to our ability to adapt and move doses around to minimize impact. But those doses have come into the state this week, and so we are rapidly working to make up the decrease that we saw last week. We appreciate the patience of all those who had scheduled vaccines that had to be delayed because of those unforeseen circumstances in other states. We especially appreciate our vaccine providers who are creating new appointment slots to make up for those doses. So far, our single day highest day dose administered was that February 11th day of almost 25,000. And the best news is that more doses are coming. We've had some big announcements this week. Moderna and Pfizer and Johnson & Johnson all testified before Congress. And we really like it when we're right. We've been telling you for over a month now that we were going to see just enormous amounts of doses coming into the state and into the country. And they confirmed all of those, that by the end of March, we will see those 200 million doses of Pfizer and Moderna, and that they had done about 80 million doses through the beginning of this week total, and that means they've got about 120 million doses to do in the next 5 weeks, which is just incredible. That's going to basically triple the weekly amount of doses that we're receiving, and we've got a call with the Biden administration next week where they will give us even better insight into those doses end of March heading into April. Also, really good news. Some of the Johnson & Johnson numbers have come out this week. We fully expect approval, emergency use authorization approval from the FDA likely by Saturday. And knowing that that's going to happen, the federal government is already getting those doses into the system, and we have been approved for over 20,000 doses of Johnson & Johnson, which is a single-dose vaccine. And again, I can't emphasize, even though the Johnson & Johnson numbers of efficacy weren't quite as high as Moderna and Pfizer, they are incredibly good. These numbers are amazing, and by the way, we're tested against other variants, which may have brought those numbers down a little bit, but means that it is a very successful vaccine, and one that we don't want people to hesitate to get that vaccine at all. We've never branded vaccines before. You don't go to get your flu vaccine or your tetanus shot and ask, well, what brand is this? So this is kind of the first time in history where we've had branded doses. I think it's really important to point out that when we look at those efficacy numbers, those efficacy numbers are against infection with symptoms. That probably isn't even the right metric for us to be focusing on. We don't talk about infections with other types of diseases, right? With colds and things. What we care about is serious illness and death, right? We care about people going to hospitals. We care about people dying. And with 75,000 across these vaccines, people in the United States who were part of those trials, 75,000, not one person, not one was hospitalized after 4 weeks, and not one person died. That is, again, a miracle. We are underselling these vaccines. And so as these new doses of Johnson & Johnson come on, and we work with our providers to get those out there, again, 1 dose instead of 2, which is also great and will help us with some of our harder to reach populations. This is all very, very good news, very, very optimistic news. Best news of all, I'm pleased to report that now over 70% of Utah adults over the age of 70 have received at least 1 dose of the vaccine. That's a statewide average. In some of our local health districts, they're pushing into the high 70%, almost pushing 80%, which is just remarkable. So I'm going to turn it over to Dr. Dunn here. 80% of Utahns, this was some great news, 80% of Utahns think the way that we are distributing the vaccine is fair, according to a recent Deseret News poll. I think there were only 9% that thought it was not fair. It's hard to get 80% of anyone in this country to agree on anything, and so we feel really good about the decisions we've made to prioritize age and risk factors over industry associations and different jobs. Doesn't mean those aren't important, and we love and appreciate everyone and what they're doing, but we're trying to prevent hospitalizations and deaths, and it's working. So that's good news. We hope to have again more announcements next week as Johnson & Johnson comes online. We'll also be talking more about some incredible things that are happening to get the vaccine out to our multicultural populations. Again, some of our harder to reach populations. We're going to be working really hard on decreasing vaccine hesitancy and making sure that everyone is able to take advantage of this incredible miracle that's going to get us back to normal much more sooner than anyone expected. So with that, I'm excited to turn the microphone over to Dr. Dunn, and then we'll take some questions. Dr. Dunn.
Hey, good morning. So our 7-day rolling average of new cases is now at 723. This is a decrease from last week when we were at 830. Similarly, our percent positivity has also decreased. Person over person calculation, our percent positivity is 12.5%, a decrease from 13.6% last week, and test over test we're at 5.7%, a decrease from 6.3% last week. And also, importantly, our referral ICUs are at 77% utilization, and that continues to decrease, which is fantastic news for our healthcare providers and those needing care at those ICU centers. I'm going to keep it short so we have time for questions, but I just want to echo the governor's enthusiasm. We are headed in the right direction. We need to continue doing what we know works with physical distancing, mask wearing, avoiding large gatherings, and most importantly, getting the vaccine when it's your turn to get it. And soon that will be open to many more Utahns, and we're excited for that day to come when we do achieve herd immunity. So with that, we'll take some questions. Thank you.
Thank you, Governor. This is Chris Reed, Georgia News. Today, Washington County is moving moderate. Now, I know something I asked last week, but I'm getting some reports now that people are walking into the stores and they'll wear their masks going in, and then the moment that they get to the back of the store, they take them off. And other people are saying, hey, people are not wearing their masks anymore. Can you emphasize at all what it means if people take their foot off the pedal at this point, right when we're close to the end?
Sure, thank you. Look, so human behavior has always been a piece of this response to a pandemic. Again, we're not used to pandemics. We don't have them very often. If you go back to the earliest points in our nation's history, these types of things were much more common, and so this has been new to us, and everyone's ready, right? We're so ready. We're coming up on kind of the 1-year anniversary of when all of this went crazy. It was the last week of the session. I don't know what day you pick or what day most people pick for when this started. For me, I mean, it started the end of February, beginning of March. But the day that we'll always remember was the Utah Jazz game at Oklahoma City that night. I should have this date seared into my memory, but I want to say it was like March 11th, and that was that's when all this started. So we're a year into this, and there is so much fatigue, and I get it. I really do. But what Dr. Dunn just said is the key. All of this is happening, and we can talk. I'm happy to talk. I'm happy to pontificate about why these the numbers are coming down so well. But there are probably 4 or 5 different reasons. But one of them certainly is that we have gotten better about the way that we protect each other and that we protect ourselves. And so, yeah, it is important not to give up right now when we are so close. But it's also important to focus on the positive piece of this. And I worry that the national narrative on this is very pessimistic when we should be optimistic. 2020, we should be, it was a time to be pessimistic because we didn't have an answer to the virus and we knew it was going to grow. And so we had to take all of these measures just to try to save as many lives as we could. But what I don't want to happen is I don't want people to hear that nothing's going to change. I don't want people to hear that we're not going to be able to get back to normal, that even if you get your vaccine, you're going to have to keep doing the exact same things that we've been doing for a year, because that's, first of all, it's not going to happen. It's going to discourage people from getting vaccines, and it will encourage people to take their foot off the pedal, right? Because they'll say, well, look, if we're just going to do this forever, then screw it, I'm out, right? And that's what we don't want to happen, and that's why we're messaging this week again a message of optimism, a message that with the rate of vaccines that are coming right now, with what we know about vaccines, with the way that that cases are coming down, with what we know about partial immunity, with what we're learning potentially about seasonality, with what we know about the way the virus is circulating throughout the state right now, that there is an end in sight. There's both the personal end in sight when you get your vaccine and you get that immunity, and there's a collective end in sight when we have enough vaccine for everybody to take advantage of that. And that's where we are now, and that's the message. So yes, it's more important than ever to keep doing this right now so we don't have to do it ever again.
¿Qué tal, gobernador? Buenos días, Francisco Vázquez de Univisión 32. Gobernador, últimamente usted se nota y se ve con más confianza al hablarle a los residentes de aquí del estado de Utah. ¿Qué mensaje podría continuar mandando acerca de cómo vamos en esta batalla contra el COVID-19 y si ya podemos ver la luz y ver una pronta normalidad que hemos conocido durante años? Gracias.
Thank you, Francisco. So the question was just what message I would share, and the message that I just shared about how we're doing in this battle, and is there a light that we're seeing at the end? And so I'll just briefly give that same answer, at least try to give that same answer in Spanish for our friends there. Así que ya vamos siguiendo adelante en esta batalla, pero estamos ganando. Esto es el mensaje que quiero compartir con todos. Es un mensaje de confianza, que estamos ganando la batalla. Hay una luz ya con las vacunas que están aquí, y necesitamos cada persona a recibir la vacuna. Necesitamos que seguimos con las máscaras, porque en unas semanas, unos meses, ya podemos regresar a normal. Sabemos que estamos muy cercas al final de esta enfermedad, y esperamos que todos tengan esta idea de esperanza al fin. And I hope that's helpful, Francisco. Thank you.
Governor, this is Jacob Klopfenstein with KSL.com. This question might sound a little bit pessimistic, but a recent Wall Street Journal analysis actually put Utah last out of all the states in the nation in terms of the share of population that has received the vaccine, at just above 11%. I assume that some of that has to do with our large population of kids who aren't eligible for the vaccine. But I'm wondering why we're last in that share of our population that has been vaccinated, and what we're doing to increase the vaccine share, especially in some of those minority groups that are more vulnerable to the vaccine, and some have accounted for less than 0.5% of the share of the vaccine so far.
Yeah, thank you, Jake. And I appreciate the question. And look, that is the worst possible metric to use. I hate that metric. Obviously, I hate it because it puts us last, but it's also incredibly unfair because you can't say what is the share of the total population who has gotten the vaccine and then say, yeah, but you can't vaccinate anybody under the age of 18. And then we're over here in the corner saying, hey, like we have the youngest population in the nation, and so they distribute vaccine based on those population numbers. So all we can do, we can't change that formula, right? They have their formula. It's fair. We could argue that there should be a different way to do it, but we can't change that formula. All we can do is get the vaccines in arms that come to us, and that's what we're doing. We went from 39th in the nation to 4th in the nation in getting those vaccines out. Now, because we had those vaccines delayed, we fell back just a little bit this past week, but we're making that up again. So all we can do is get those vaccines in arms. That's it, and that's what matters. But again, what I'm focused on is what portion of the population is getting vaccinated. That's more important to me. I would rather have, I would rather have 70+% of those 70 years old and older vaccinated than having 14% versus 11% of the entire state. And this is where Utah is again succeeding in incredible ways, because I want to point out 73% of our deaths are in those age 70 and older. So getting 70% of them vaccinated, that's just a huge number. So that's where our focus is, and I can't wait, because in just a few weeks, every question we get is based on a scarcity model, right? And so we're having to deal with this scarcity model, and I keep telling people, guys, stop worrying about scarcity. Let's start worrying about abundance, because in just a few weeks, we're going to have more vaccine than we know what to do with. I mean, we know what to do with it, but my point is this. We're so worried about who gets their vaccine today and why aren't we getting more in this when we're going to have to, starting into April and May, our biggest concern is going to be vaccine hesitancy. Like, how do we convince people to get this vaccine because we have so much of it? And that's really where our focus needs to be. And the last part of your question is reaching out to some of our communities that have been historically underrepresented in healthcare, in everything else that we're doing. And we have an entire plan. We'll be sharing it next week. It's already been implemented, but we'll be sharing the contours and details of that, working with community partners, as we have done from the earliest days of this virus, to help get two things. One is to get the vaccine into those communities. But more importantly than that, it's to convince them where there is this hesitancy that it's okay and it's safe to get the vaccine. So, I'll give you an example. Working with churches in those communities to have, maybe even have vaccination sites at the churches, right? With people that they trust, people that they believe in, instead of, here's the government setting this up and you have to come and do this that maybe doesn't work. So who are those trusted partners? And then a big media campaign about, again, messaging, this is how you get back to normal. And we hope, we're seeing those numbers tick up. That same poll that I mentioned saw a significant increase in people who are willing to get the vaccine. And I believe that as more and more Utahns get the vaccine, people see that there are very few side effects. People see that the case rates are coming down and that they're safe and they can get back to normal. That's going to have this abundance mindset now. People will feel safer because grandma got it and she's okay. Or I have a friend that got it and he's okay. I'm going to get it now, and that's going to make a big difference. Okay, we got time for one more, and then I think Dr. Dunn can maybe answer a few more.
Hi, Governor. Lisa Roche here. I'm wondering, I appreciate your optimism about messaging that things will change as people become vaccinated, but aren't there still concerns about transmitting the virus, even if you've had a shot? I know the studies are promising, but they're still not definitive. As well as other concerns about moving too quickly, including the issue of variants. Those variants of the virus are spreading quickly. A lot of health experts have talked about there being a race between getting enough people vaccinated ahead of allowing the virus the ability to mutate to a point where the existing vaccines won't work. So how do you balance those concerns with, as you say, letting people, messaging to people that once they get vaccinated, they'll have a lot more freedom and not have to wear a mask or be able to congregate in larger groups, et cetera. How do you balance those two health concerns?
Yep, it's a great question, and really, that's been the issue through the entire pandemic, right? And sometimes we've gotten it right, and sometimes we've gotten it wrong. And I really want to be thoughtful about this because it's a thoughtful question, and it's one that I've struggled with significantly. Many of us have been right on issues in this pandemic, and many of us have been wrong at different times. If you go back, and I would challenge you to do this, go back in December and look at every single model of this disease, every single expert. I did this. I went back and looked. All of those models showed that this virus and this last wave of the virus would peak in March, and that it would be a significant peak. And then it would slowly, and I mean slowly, start to come down after that. Every single one of those models was not just wrong, it was wrong by magnitudes. Now, it doesn't mean that they're bad people. It doesn't mean that they're bad scientists. It doesn't mean that they don't know what they're doing. It just means that things changed. And for all those reasons that I mentioned earlier, and maybe some others, certainly there's some partial immunity out there, and maybe partial immunity about groups that maybe didn't take it as seriously or couldn't take it as seriously because they were frontline workers or whatever. So there's some partial immunity. There's a whole bunch of people that have been really, really careful, and now we have vaccines coming on. There's probably some seasonality to this. We've got better masks, and we know that they're working. All of those things, more testing and contact tracing, all of those things have proven those models wrong, right? We made other mistakes earlier by not doing masks, by not mandating those earlier, which could have helped and maybe save some lives. And so there is this balancing act, and everyone has a different job to play. Dr. Dunn's job is to assess risk and to be cautious and to share those risk profiles with us, to let us know what we're learning about variants, what we're learning about all these things. And by the way, I would say more good news on the Johnson & Johnson numbers, because they were tested against variants in South Africa, and the numbers were really, really good, and that's the variant I think that people are most worried about. And so there's all this positive news. Yeah, so maybe we don't know 100% that you can't transmit the disease if you've had your vaccine, but we also don't have one shred of evidence that you can. And in fact, all of the evidence that we've seen so far says that you can. And all of those things are telling us that we are underselling the positivity of what's happening out there. And the fact that vaccines are going up. See, we thought vaccines would be going up at a time when cases were spiking. But we've ended up with the perfect storm. That's usually a bad thing. This is the good side of a perfect storm, whatever that is. The best sunny day possible, where vaccines are peaking and increasing when cases are already going down. And so that's why we're so optimistic. That's why I'm able to say, look, by the end of April or the beginning of May, we will have enough vaccine for every adult in the state of Utah who wants a vaccine, which we anticipate at 75% somewhere in there. And 8 weeks after that, which gives you a chance to get your second dose and get 10 to 14 days beyond that, right? So 8 weeks minimum after that, assuming we're still in a low transmission state in your county, then these go away, if not sooner. That's why we can say that. And we can say that with a pretty high degree of confidence right now. But that doesn't mean, we may be wrong. That could totally change in 2 weeks, just like all of those models were wrong, right? And if it does, then we'll adjust. But it's important. It's important from a mental health aspect. It's important from a behavioral health aspect, and I believe it's important from an epidemiology standpoint to let people know that there is an end in sight, so they'll keep doing this. Because otherwise, they're going to quit now, and we don't want them to quit now when there's still the potential for those outbreaks to happen. So I apologize for taking so much time and pontificating so much, but it's something I'm very passionate about. I'm telling you, I'm not going to be wearing this on the 4th of July, and I'm going to be in a parade somewhere, and you're going to be there covering the parade, and you're going to be really excited, and we're going to put these in the fireworks and blow them up or burn them or something. I don't know what, we're going to do something, but if I'm wrong, then I'll come here and I'll admit that I'm wrong, and that we're going to do something different, and we're going to again do whatever we can to save lives and keep people safe. But the last thing I have to say, there comes a time in a pandemic. My comms team's over here going, "Oh, we're going to have to clean all of this up." The idea of government in a pandemic, I think it's really important philosophically to understand this. When we have a disease that is killing people and has a potential to overwhelm our hospitals. By the way, the Mountain America Expo Center, Southtown, what do we call that? Is that right? Yeah. Guys, we were days away from taking patients there. Patients who had COVID and could die. We were maybe hours away from our ICUs being overwhelmed and having to use this triage center. And now it's a place where people are getting vaccines. And our ICUs are at the lowest, the lowest place that they've been at since like September, October, somewhere in there. That's how close we are. So government has, during that time, we have an obligation to each other to protect each other. That's why governments exist. And this is one reason that governments exist. And so governments have to make decisions, and we hated every one of those decisions we had to make, but we have to make decisions to protect each other. We have a duty to protect each other. At some point, we're not very good as humans at understanding risk assessment and risk levels. At some point, that changes to where now, if you're worried about your risk, it's low enough, then you need to take those precautions, and you need to get a really good mask, and you can wear that mask. We're not going to tell you can't wear a mask. You can wear a mask. I have a sister who has to wear a mask every winter because she has cystic fibrosis, and if she gets the flu, she'll die. And so she has to take those precautions, but everybody doesn't. We have a high earthquake risk in this state, but we don't every day hide under our desk because there could be an earthquake, right? I could wreck in the car tomorrow, but I'm still going to drive. At some point, and we're headed towards that with vaccines, people will have a choice to get a vaccine. People will have a choice to protect themselves. The risk profile is going to change, and we'll have very little spread, we'll have very little hospitalization, and very little death. And at that point, then, it's not government's job to step in and mandate and keep everyone safe. When that changes, then it becomes everybody's responsibility to take care of themselves and take those precautions and do the best they can. And I just spent way too much time on that answer, and you're going to pick out the two sentences that will get people really fired up, and you're going to print those because I talk too long, and that's your job, and that's okay. And thanks. And you want to ask another one?
I just wanted to follow up, Governor, on a couple things you said. So those sentences aren't just taken out of context.
No, and you won't take them out of context. I'm not saying that, Lisa. That's your job.
No. And I totally appreciate your enthusiasm as someone who's sat in a basement for far too long. I'm looking forward to the 4th of July as well. You talked about it might have been better if we had issued a mask mandate sooner. I know that was a big issue during your campaign for governor. Do you regret Utah not doing that sooner? And also, you said end of April now for every adult to have the opportunity to get vaccinated, not the end of May. Did I understand that right?
Yeah, again, just looking at the vaccine totals, once what we based that on, and you'll notice there was a change to the transmission index that there was so first of all, there's a bill out there. The legislature could define when this ends and when all of these things go away, and that's their prerogative. They're certainly open to that. And so we brought a group of people together, a group of health experts, others who came together to say, okay, what could this look like to get out of this? So we included in the transmission index this idea that once we have enough vaccines for 70% of the adults in the state of Utah, that once we have access to those vaccines, then 8 weeks after that, that gives us some time to get them out, and time for people to get a second dose. And then 8 weeks after that, those mandates, if we're in low transmission, right? So all of those things. So the low case spread, low hospitalization, low percent positivity. When all of those things come together, then those things go away. Looking at the potential vaccine availability with Johnson & Johnson getting approved, with what we heard in Congress this week, those numbers could come as soon as the end of April, but more likely probably mid-May, sometime in there. That's what we're looking at. So those are kind of the dates that are out there, but all of those are subject to change. Yeah, and when it comes to masks, we've learned a lot about masks. In the early days, the medical community said don't use masks. Masks don't work. I was talking to a group of doctors in the first or middle of April when we first started recommending people wear masks. And they said, why didn't you recommend it sooner? I said, because you told us not to. And they said, you're right. We told you not to. And that was very dumb of us. And they regretted that. And so, and then we learned more about how effective masks were. And in retrospect, we could have and probably should have mandated that. We had lots of people wearing them. We were recommending them. In fact, Utah was one of the only states that actually had masks sent out to people who wanted them. So we pushed really hard on masks, but yeah, sometimes we don't get it exactly right, and that was probably one where we could have done it a little bit earlier. And now I've talked way too long, and I hope you enjoyed it. So thank you. I don't know what to say. It's been a really long year, and it's been a really this legislative session has been tough, and we're grateful to see it coming to an end. We're all a little punchy right now, I guess, probably. And but I just maybe I could end here by thanking all of you for what you're doing. Lisa, I hope you took that as the joke it was intended to be when I said you all have space limitations, and you all do the very best you can and do. And sometimes I agree with everything you write, and sometimes I don't or say. And that's okay, because you have your role to play too. And you've played it very, very well. I want to thank all of you, because it's very easy to focus, especially on vaccinations, on the one bad story, right? Where maybe somebody has a bad reaction to the vaccine, and that could get a lot of clicks. But you all have avoided that. You've been very fair in telling that story. Again, over 600,000 doses now delivered in the state of Utah, and so we can't do this. We can't do this without you. The information that you share has to be accurate, and almost entirely it has been over the course of the vaccine. I mean that for everyone on this call. So thank you for being partners in getting good information out. Thank you for sharing what we're doing today. Thanks for taking it easy on me with anything I said today that I shouldn't have. You're awesome, and good luck with the rest of the session. Thanks, everyone. And sorry, Dr. Dunn. Good luck cleaning that up. Thanks.
Did you say KSL radio?
Okay.
Okay. Dr. Dunn, I know the Johnson & Johnson vaccines are single dose, and that kind of, you guys are still kind of deciding where they would be most effectively given to. Could you kind of think of maybe some examples of where those vaccines would be more effective than, say, the double dose vaccines that everybody else is getting?
Yeah, absolutely. So we're actually really excited for Johnson & Johnson for twofold, right? It's one dose and it doesn't need to be in super cold storage. The thing that we really need to be careful not to get ahead of is that, it's going to go under FDA official review tomorrow, and then it goes to the CDC for contraindications, which population should get it, et cetera. So there's still more to come in terms of official guidance we will be getting on the vaccine, but I will tell you we're already prioritizing populations that will benefit from a single dose, right? So those populations that might not be able to easily come back for a second dose. And so ones that, we might use in our mobile vaccination clinics because it's easier to transport. So we're looking at all those sorts of variables, but again, are going to have to really wait for that official review from our federal partners.
Good morning, Dr. Dunn. The question, when we talk about the Johnson & Johnson vaccine having a effectiveness rate of high 60s, low 70s, is there a danger, is there a concern of vaccine snobbery of sort that, I'll wait for the Pfizer or the Moderna because they're up in the high 90s?
Yeah, and again, you cannot compare those numbers. It is the comparing apples and oranges. The clinical trials that went on for Pfizer and Moderna were months ahead of the Johnson & Johnson one before we had widespread variants circulating. Johnson & Johnson did include variants, and it is effective against the variants, which is super exciting. In addition, the Johnson & Johnson vaccine is over 80% effective at preventing hospitalization and death. So from my perspective and the experts across the country, there is really no reason to want to choose one or the other unless you have a condition that is contraindicated to one. So it is really exciting to soon be able to have 3 options that are all effective at preventing COVID-19. Right. Oh.
I do.
Okay. Go ahead. I'll clarify in the next.
Francisco Vasquez from Univision, Dr. Angela. We just heard Spencer Cox, the governor, being so optimistic about the next upcoming summer. What are your thoughts? Is this something that we can be happy looking forward in the next weeks, months? Thank you.
Sure, absolutely. And I'll just clarify what I said about the Johnson & Johnson. It was 100% effective at preventing hospitalization and death, and over 80% effective at preventing severe disease. So even better reason to not really worry so much about what brand vaccine you get. I think we have, of course, I echo the governor's enthusiasm and really hope that we do get to that point of more normalcy by the summer. I think it is certainly possible. It's going to take all of us continuing to adhere to public health recommendations until that point. We're not at the point yet where we can rely on vaccines as our only prevention measure. So in order to get to that point, we need to prevent spread and keep our case counts going down through mask wearing, social distancing, and avoiding large gatherings, so that by the time we have enough vaccine available for everyone, it will work, and it will work quickly. Okay, perfect. Thank you. Have a good afternoon.
All right. Thank you, Dr. Dunn and Governor Cox. And that concludes our briefing for today. We will be back next week to talk to all of you. Thank you to all of our media partners. Have a good Thursday.